So we will be discussing the remnants and ectopias of the cervix, uterine cervix. So this is the mesonephric or the Wolffian rest, which are the tubules lined by a single layer of cuboidal epithelium containing dense eosinophilic secretion. The eosinophilic secretion is diagnostic, and these are PAX8, PAX2 and GATA3 positive. The second important thing is the squamous metaplasia of the endocervical glands, which is a reactive condition or a metaplastic condition. And then coming to this important thing to remember is that sometimes the squamous metaplasia can have a complex pattern. Then how to differentiate? Then you have to do a P16. If P16 is negative, it is squamous metaplasia. If P16 is positive, then you have to think about Hetzel. Then next condition which is seen in elderly females is the transitional metaplasia. That is, the squamous epithelium looks like transitional. This is a benign condition. In this also you can do the P16 to differentiate from Hetzel. Then the next important condition is a tubal metaplasia of the endocervix. That is, the endocervical glands become tube-like. That is, having ciliated, secretory and intercalated cells. Then sometimes it can be tubo-endometrial also. Then how to differentiate? Again you have to do the P16 and the Ki67. Then chronic cervicitis, then herpes simplex. Herpes simplex, we know the multinucleated giant cells and the multinucleated epithelial cells and the intranuclear inclusions. Then we have to think about the chlamydia trachomatis. In that you have to see the lymphoid follicles, and culture is important to diagnose. Then sometimes we also have actinomycosis, bilharziasis, arteritis, malakoplakia, spheroid granuloma. Then the non-neoplastic glandular lesions, we have the endocervical polyps, which is nothing but the papillary architecture of the endocervical glands called as a papillary endocervicitis. Then this next is the important is the cervical tunnel clusters of the cystic type. Tunnel clusters are nothing but the benign endocervical glands which are cystically dilated, something like Nemothean cyst. But there will not be any inflammation. There will be only dilated branching glands with secretions inside. Then this is a microgranular hyperplasia. An important clue to the microgranular hyperplasia is the presence of inflammation. Sometimes they can be solid, so then you have to do the CEA. CEA will be negative in microgranular hyperplasia, differentiating it from adenocarcinoma. Then the next important condition is the diffuse laminar endocervical hyperplasia. That is proliferation of glands, but there is no ATP, no desmoplasia, because we have to differentiate this from adenoma malignum. Then another picture of the mesonephric duct rest having the dense inspissator secretions and the single cuboidal lining. Then sometimes you can also have the multinucleated stromal giant cells, the cervix. Then this is the decidual reaction. Decidual reaction can look grossly like a carcinoma, which is friable. So that is the very worrisome feature, but these will be the PCK negative. Then placental side nodule, nothing but there is a collection of the intermediate trophoblasts. But if you do the human placental lactogen, it will be positive. And sometimes endometriosis can happen.